Leave me
Should
shine.
I talk? I mean, I know I
Welcome,
talked-
Facebook. We're over here at
Should I?
medical doctor Popkin, his Integrative Medicine Institute here. We're going to have a healthy happy hour starting right now. Welcome, welcome.
All right, Joe, we're going live on the main page.
Here we go.
Tell me when we're ready.
We're ready.
You ready?
We're live.
Okay, welcome. This is our weekly Healthy Happy Hour at Popkin Integrative Medicine. And as always, we appreciate your time. You've given us your best and most important commodity, which is your time. We have people here in the office as well as people out in Facebook land. So hopefully we can give you some information that's going to be helpful and useful. First, I'm going to start off by saying that I have presented over the past couple of weeks a number of recent studies from very qualified journals that talk about the importance of nutrition and lifestyle in preventing diseases such as heart attacks, strokes, cancer, and preventing obesity. So we're getting a lot of support in the medical literature to show that by adopting a healthy lifestyle, whether it's veganism or vegan-ish, or decreased animal consumption diet, or just a healthy lifestyle, all of which supplemented by Purium products, we know that we're going to be affecting health in a positive way. So everybody here in this room and everybody that's listening to me out on Facebook can really do a good job by sharing all of these products in the lifestyle and do a really good job to help prevent and decrease all the comorbid diseases that I mentioned. And I think most people are most concerned about heart attacks and strokes and cancer. But we can also throw hypertension and diabetes and arthritis and gout and pretty much everything in there. This is a decreased inflammatory diet. So basically all of these diseases are inflammatory based. So you're going to be managing your inflammatory load. We talk about this every week. We manage our money, our time, our families, our jobs. But we don't put the time to managing our inflammation. So by doing a healthy diet, healthy lifestyle, stopping smoking, moderate alcohol, regular exercise, and supplementing with Purium products, you're really doing a very good job to manage your inflammatory load and thus protecting yourself. So the best thing that you can do is share this lifestyle, share the products, and be confident that you're doing something that's really positive for your health. So the recent studies that I have been presenting over the past several weeks obviously back that up. Not that we needed studies to show that having a healthy lifestyle will prevent disease, but some people may need that certification, so to speak. What we do here at Popkin Integrative Medicine is we're taking a very proactive approach to linking this lifestyle with the diagnosis and treatment protocols and helping to guide our patients into a healthier lifestyle and help to treat diabetes, blood pressure, and all those things that I mentioned with what we call lifestyle modification. What I like about Purium products is that it's a turnkey system. It's a system that people can follow. Whether you're doing the transformation, whether you're doing the core 3, whether you're working with people that brought you into the business of taking care of your health, what you're doing is you're following a system, and that makes it easy for people to share, people to follow, and to be consistent with. So what we do is we, at Popkin Integrative Medicine, is for everybody. We do a good history and physical, which includes a family history, because we can look into the future if we know what your parents and your grandparents were exposed to or had problems with. So we know if there's heart disease in your family, we're going to be super diligent about looking towards finding something reversible if there is something present in yourself. We do EKGs on people, basic lab work, advanced lab testing with the Cleveland Heart Lab testing, measure all the inflammatory numbers. We do food sensitivity testing with biogenetics, looking for foods that you would be sensitive to so we can eliminate them so they don't cause inflammation. We also do non-invasive testing with ultrasound, so we look at the carotid arteries. We do carotid intimal medial thickness testing. We do cardiac echocardiogram. We look at the aorta, the renal arteries, and the peripheral arteries. And we really get a good idea of what your vascular system looks like, because this is really what we're trying to risk stratify you for when we're trying to decrease heart attacks and strokes. Then for people who need further testing, we do cardiac calcium score or CT angiograms of the heart to look for calcifications and early heart disease before it becomes a heart attack. And then once that's done, if anyone is still a high predictive value and needs further testing, that's when they would be referred out for, let's say, a nuclear or a nuclear stress test or an exercise stress test. So we're really trying to find out who in our patient base is at highest risk of having a heart attack. So that's the medical aspect of it, and what we're doing is we're pairing the medical diagnosis with the treatment. Now, if the treatment is lifestyle modification, diet, exercise, and supplementation with Purium products, everybody here can be their own doctor and their own best advocate. And not only that, but you can share it with other people, and that's a very powerful thing. So the bulk of what I want to talk about is the transformation versus the core 3, because now we have a lot of patients that are taking this, and we're getting a lot of very similar questions. And one of the basic questions that I get for the transformation is people say, can I eat food? Is everything going to be powder and liquids and drinks? And you're absolutely eating food. And I'll explain to them that you're going through a regimen that is, I wouldn't say complex, it's just very structured. Every 2 hours you're doing something, whether it's your aminos or a shake or your flex foods. And the important part about it is your flex foods are foods. Just because they're fruits and vegetables and healthy foods, some people don't get the concept that that is actual food, which is the sad part about our American diet. People will look and will see, and I have a list of them here, your recommended shopping list, and this is in the brochure, and this is in the literature, and you can find this on the website. It's just amazing that when people say, can I eat rice, bread, cereals, all do, and you can see how different your foods are compared to what you were doing before. That's what leads to your healthy lifestyle. That's the transformation. There's nothing magic, so to speak, in doing a cleanse or a transformation unless you're changing your lifestyle. You're not going to do a 10-day transformation and then leave it at that. Everyone asks me, what do I do after the 10-day transformation? And I say you're going to do the 10,000-day transformation now. You're transitioning into a healthy lifestyle. And that doesn't mean that you're going to be eating tree bark and sawdust for the rest of your life. That's not what we're doing here. We're having you eat healthy foods, and as you go through and you look at the list of foods you're allowed to eat, it's really very healthy and very satisfying. And when you supplement with the Purium products, you're really doing a very good job at managing your inflammatory load and decreasing all of your risk for diabetes and heart disease and cancer and obesity and gout and you name it. So it's more of a lifestyle. It's not a magic bullet. It's not taking a shake and all of a sudden magically you get thinner or healthier. You're adopting a healthy lifestyle, and that's really what I like about this, is that it's a program, it's easy to share, and I think everybody that has a positive response from it wants to share it. They have a very nice sharing system as well with the gift cards and so on and so forth. So now with the transformation, obviously it's a very regimented structure. Every 2 hours you're doing something. You go into the core 3, and the core 3 is really, it's similar to a transformation. It's just less, I want to say less structured. So essentially what you're doing is your aminos in the morning, you're doing a shake for lunch, you're doing a healthy dinner. But I kind of destructure it a little more, and I tell people it's whatever you want it to be. If you want it to be a shake for breakfast, a shake for lunch, and you have your dinner, and then at night you do I like to do the fiber blend shake at night. So for me, it satisfies any hunger that I may have. Some people, there's days that I don't have time to make breakfast, so I'll have a shake, and maybe I'm having lunch somewhere, so I have a healthy lunch. Times I come home for dinner, I may not want to make something, I'll have a shake. So you can pretty much do and tailor it to your lifestyle. You're not going to mess this up. It's not a diet, it's a lifestyle. That's another thing. Most of my patients, prior to doing some kind of a structured formula, they were used to these diet plans, where whether it's HCG or the Oprah diet or the cabbage diet, and you have to stay the Atkins diet. If you have carbohydrates, you're going to throw yourself out of that metabolic state, and you're going to ruin the diet. This isn't a diet. This is something that you're following. It's a healthy lifestyle. So the key points that I had on both the transformation and the core 3 were exactly the same thing. It's preparation and it's consistency. So when you're doing your transformation, you want to make sure that you have your products available. You want to make sure that you have not only your Purium products, but your flex foods. And you want to make sure you have the means to carry them around as well. And it's no more difficult than having a soft-sided cooler, than having Tupperware containers, and the night before or the morning of, you make your meals and you go on about your business. I've had certain of my patients, they've said to me, well, they have a very busy lifestyle, they can't follow it. And I say, well, I have a very busy lifestyle, and I'm able to follow it. And it's really very simple. Bring your foods with you, because it takes longer to stop off at Applebee's or at fast food. It takes longer to stop and eat that type of food than it does to bring your foods with you. It costs more to stop at restaurants, and it costs you more not just in your wallet, but in your health. So when you're eating something bad, every time you put something bad in your body, that's a hit to your chromosomes, that's a hit to your vessels, that's a hit to your brain and your heart and your nose and your toes and everything that you're fond of. You don't want to do that to yourself. So the healthier you are and the more you watch what you put into your body, the better off you're going to be. So basically at Popkin Integrative Medicine, we have our physical location here where people come in and we do all the testing that we talked about. We do the nutritional counseling. We have our Purium professionals that offer us support and fantastic support to all of us. But we also have a telemedicine program because we're getting a lot of people now that are either calling us up or emailing us, and they live out of state and they don't know what to do. They don't know how to get the testing done. Their doctors don't do it. They're just not sure, and I don't want to present information on Facebook to however many people are watching and not be able to offer a solution. If I can see you here in the office, obviously we can do something for you. So we started a telemedicine program for the Purium folks. If anyone is interested in doing any of the testing or would like to help add the medical component to it, if you have diabetes or high blood pressure, or you really want to know your risk for heart disease, we have a telemedicine program where you call us up on the phone and we will talk with you. We'll go over your history and your physical exam, gather all of your information. We'll order your Cleveland Heart Lab testing. We'll coordinate with your insurance company as far as the payment of the labs from your insurance company. We get the results back. We talk to you on the phone, and we guide you. Whether if you live in Montana and you might need to go see your primary care physician for certain things, we'll make that recommendation. If you need supplementation with Purium, we're going to basically guide you as to what to do and how to follow up. And we have price lists that we're going to post on Facebook that are extremely reasonable, and it's something that will allow us to reach out to everybody, whether you're here in Hollywood, Florida, or in South Florida. We've had people come down as far as Stewart and Vero. I have somebody coming down from Orlando. We have people coming over from the West Coast. But if you're anywhere in the United States that it might be difficult, or you may not want to travel that far, we have the telemedicine program. After this, we'll post all that information and get that information out to you. So that's basically what I wanted to talk about, is the transformation in the core three. Again, what we talked about is preparation and consistency. You want to make it as simple as possible for you. Purium is already making it simple. You don't want to complicate it any more than you have to. And if all you need is some Tupperware containers and a soft-sided cooler and some reading materials, I think that's probably the easiest way that you can help yourself and the people around you to share. So, yes.
Would you, before you finish up, would you just touch on TMAO and adiponectin
Sure.
as far as compared to using Purium products?
Absolutely. One of the things that we love doing here is coming up with using tests to give the validation as to why you're going to spend the money and the time and the effort to change your lifestyle. It's one thing for us to say you're going to be healthier, but it's also another way to prove it with numbers. So first and foremost, people's blood pressure and their diabetes numbers and their weight is going to come down, and that's easy to look at. But a couple of the tests that we do that are very novel to Purium, adiponectin has been talked about a lot over the past couple of months. Adiponectin is the skinny hormone, but I also call it the anti-diabetes hormone and the anti-heart attack hormone and the anti-cancer hormone. And in 3 months, I have yet to have somebody give me any intelligent argument against that, and I would challenge anyone to do so. The reason it's all these different things is adiponectin causes your body to break down free fatty acids so that they can be consumed so you can decrease fat. It also stabilizes the lining of your vessels, so it helps to prevent or decrease your risk of heart attacks and strokes. It manages your blood sugar and helps to stabilize your blood sugars in a number of different ways. So it helps with diabetes or metabolic syndrome or insulin sensitivity or insulin resistance. And since the Purium products help stabilize your gut and help with gut health, it decreases gut inflammation. 70% of your immune system is in your gut. Therefore, your immune system is revved up, so it protects you against infections and cancer, because our body makes cancer cells every day that our immune system fights off every single day. So the stronger your immune system is, the stronger chance you're going to have of preventing heart attacks and strokes and infections and cancer and all those different things. So that's adiponectin. I love it. It's a very multi-purpose hormone in the body, and the Purium products in particular the fiber blend helps to increase adiponectin. So when we measure people's adiponectin levels and we do a transformation and a 3-month core 3, we can retest them. And it's a really nice way to validate people taking the time and the effort and the money in transforming their lives. And it gives them that number that they can say, hey, my adiponectin went up. Maybe I'm doing something good for myself. Rather than, they can see they're losing weight, they can see they feel better, and that should be enough, but some people need numbers, and we're doctors, we love seeing numbers, so that's adiponectin. TMAO, trimethylamine, is a product that is formed by gut bacteria, and when gut bacteria interact with certain foods, such as red meats and full dairy products like eggs and cheese, it produces a byproduct called trimethylamine, which goes to the liver and the body tries to clear it, so it oxidizes it and becomes trimethylamine oxide, and then once it's oxidized, the body removes it from the blood. But in so doing, we have damage to our vessels, and that can lead to heart attacks and strokes and other types of problems. If the damage occurs in the pancreas, the beta cells, the islet cells, it causes diabetes. If it happens in the arteries and causes blockages in the heart and the brain, you get heart attacks and strokes. So TMAO is something that you do not want, and it's a direct result of a poor diet, and you can see direct correlation between decreasing meat and dairy products and TMAO levels. So it's a very nice way to validate what people have, what people are doing in their current diet and how to fix it. So these are just two of the things that we look at. I could very easily talk about MPO, F2-isoprostane, oxidized LDL, homocysteine, LP-little-a, subfractionations of HDL and LDL, and all the different things that we do here. I love talking about them, so if anyone has any interest, we will post our email address on there, and all I ask is that in the subject line just put Purium so we can recognize it easier and it doesn't go to our spam. So hopefully that answered the two questions on adiponectin and TMAO.
Thank you.
Excellent. What I'm going to do is I'm going to have Dr. Cameron come up and talk a little bit about type 2 diabetes. In our experience, very, very important, we get a lot of questions on what medications to discontinue or how to put Purium products into a diabetic diet. When you do Purium products, you're going to greatly decrease your glycemic index. The foods that are going in are going to greatly decrease your sugar. So if you're on insulin or a sulfonylurea like Lipizide or Glucotrol, you're going to want to coordinate that with your physicians. Also with blood pressure medications, again, you're decreasing salt, you're decreasing fat, you're decreasing your weight. So what's going to happen is the blood pressure is going to come down. And a lot of people, we have to adjust their blood pressure medicine. So I think it's very important that you would coordinate this with your physician and just be very cognizant of that. So this is something that we're excited about. It's always a nice thing to tell a patient we're going to take you off of medication, not add new medications.
Beautiful.
So having said that, I appreciate your time. Dr. Cameron is going to talk about type 2 diabetes.
Excellent. Thank you.
Thank you.
Thank you, Dr. Popkin. Yeah, back in the 1940s, there was a disease called polio. And people were very concerned about that because it affected children, and it caused paralysis, and you couldn't go in swimming pools, and lo and behold, a few years later they developed a vaccine, and we have basically wiped out polio. But there's another epidemic right now that everybody seems to be asleep at the wheel, and that's type 2 diabetes. Type 1 is when your pancreas does not make enough insulin, and that used to be categorized as children, occasionally adults get it. But if you took all the diabetics of the world, type 1 is a small fraction. Type 2 is the majority, 99%. And right now, in the United States alone, 50% of adults are either diabetic type 2 or pre-diabetic. 50% of people. Children. If you have 3 children, the statistics show that 1 out of your 3 children will develop diabetes.
Wow.
Okay?
Wow.
And it is purely a lifestyle disease. It is reversible. Okay? And if any doctor says it's not, he's not trying hard enough. So we are in a mission here at Popkin Integrative Medicine to treat and discuss diabetes with anybody who is willing to contact us. I'm going to be posting my email address, but I'll give it to you right now. It's drbruce@pim@gmail.com. So please, if anybody is out there wanting to know more information about this, I want you to email me, and we'll set up a free 10-minute consultation by telemedicine. So anybody, anywhere, if you can get to a computer and email me your address, I can send you instructions so we can talk to you about this. And I know 50% of adults out there are dealing with this issue. In Great Britain, every week, 100 people get a limb amputated because of diabetes. Okay? This is an epidemic. If I told you that you were obese and that you were destined to live with that for the rest of your life, you'd go, no, doc. I mean, I'll just do this, this, and this, and this, and I'll lose weight. We've all done it at times. Oprah many times, okay? Diabetes type 2 is no different than obesity. It is reversible. It's lifestyle modified. Eat differently, exercise more, and your numbers will go back to normal. And here at our clinic here, we measure all the numbers that we need to follow. It can be a subtle, intricate way of dealing with health, but it is totally reversible. And another thing is that many supplements that are not expensive at all have been shown in studies to bring down sugar in the bloodstream, insulin, just as well as a lot of the pharmaceutical medications. The medicine Humulin, which is a synthetic insulin. They call it Humulin because they want you to think that it's human insulin. It's totally GMO. It's totally genetic modified synthetic insulin. In fact, they used to have insulin made from pork, which was way closer to human insulin. They took that off the market, basically. Very, very difficult to get. Pharmaceutical companies are always coming out with more medicines to lower blood sugar. Half my free CME is based on pharmaceutical companies wanting to teach me something new about another drug that will lower sugar. High sugar is the symptom of diabetes. It's not the root cause. And here we try to get to the root cause. The root cause, as Dr. Popkin has mentioned, is insulin resistance. It's the same thing as when you drink alcohol and you have to keep drinking more alcohol to get the effect of alcohol. That's what happens to your body because we are just inundating our body with sugar. It'd be like going to a gas station and putting the gas hose in your tank and just letting it fill over the tank, spilling all over the place, and you go to that person, what's going on? Do you need help? He goes, yeah, I need a bigger tank. No. That's what people are doing, though. They're to allow themselves to continue to eat so much processed sugar, they're taking medicines, basically, to make the tank bigger. But all they're doing is making their body more resistant to the sugar. Your body just says, there's more, and your cells just get used to all that sugar. So that when you start taking insulin, resistant to the insulin, okay? It's not the way to treat it. The way to treat it is to change what you put into your body and therefore lower your insulin resistance, allow your cells to go back to their natural states when they don't need that much insulin to deal with the sugar they're taking. And that's what Purium products are very, very good about. High in fiber, low in carbohydrates, low glycemic index, which means that when you eat sugar, if you have a high glycemic index, it spikes your insulin very, very quickly. So all sugars are not created equal, okay? There are good sugars and there are bad sugars, okay? And processed sugars are the worst. And the oils that we're cooking in, bad. It'd be funny if it wasn't so serious, but Panera now is having a new marketing campaign to try to position themselves as this great, all-natural, non-GMO restaurant you can go to. Without commenting exactly on what they're selling there, the real take-home message is they're comparing themselves to all the other companies out there that are just giving you really, really bad food when it comes to your body. And unfortunately, the food industry has all the lobbyists. Nobody's going to protect us from the food industry. We have to protect ourselves. We have to educate ourselves. We all have to be our own doctors, okay? And the great, beautiful message is that it's not complicated and we can all do it. So just like most of the diseases affecting and harming people today, they're reversible. But we have to wise up and we have to start treating our bodies better with what we put into it and how we move and how we interact. You know, very, very, very subtle things. Now there's studies showing that the people you eat with and where you eat affects digestion. And digestion affects insulin levels. So it's all tied in. It's all being mindful. It's all having the right attitude. It's all about taking a moment and saying, can I do better to my body? Because down the road, you're going to be really, really glad you did. And so, again, we're going to post my email for the telemedicine.
Say it one more time, please.
It's
people are asking.
DRBRUCE, period, PIM, @gmail.com. We'll post it. I'll answer all emails. We'll set up telemedicine. We'll give you a free consult over our telemedicine program. And hopefully we'll be able to turn the ship around on a lot of people and start decreasing the 50% of people that are diabetic or going to